Hi, this is Aaron Getz from Mammoth Hospital. I recently sat down with Dr. Kyle Howell to discuss his thoughts on the recently developed coronavirus vaccine. Dr. Howell is a member of our coronavirus response team and the incoming chief of staff at Mammoth Hospital. I wanted to know if he had planned on getting the vaccine once it was available. What follows is a shortened version of our discussion. How do you feel about the state of affairs with coronavirus right now?
Up until now, we've just been trying to hold our ground, and it's obviously tough, and it hasn't always worked. We've had a tragic loss of life. I think everyone's really lonely right now. Our economy has struggled as a result of the coronavirus. And on top of all this, we're seeing a surge right now that looks very serious. And I think that's in part because we're all feeling a little bit of battle fatigue, and it's getting harder to continue to be good and do the things we need to do to contain the virus. And as now we see our hospitals running out of ICU beds. Despite that, I'm actually optimistic right now. And I'm optimistic because we have a tool to finally fight back against the virus. We have this vaccine that's been shown to be amazingly effective and amazingly safe.
Do you think everyone should get the vaccine?
Everyone needs to do what they feel comfortable doing in the end. We're sort of at this weird point in time where I think a lot of people are just sick of being told what to do. And so I don't want to do that in this video you're going to post. What I'd rather do is share with you my understanding of the vaccine as a medical professional and someone who's studied medical sciences for over 25 years and has watched this development of the studies very closely, and I'm going to share with you what I'm going to do.
Is the vaccine effective? Do you really think this is going to protect people from coronavirus?
Yeah, the vaccine is extremely effective. You can still get coronavirus if you receive the vaccine, and that's how vaccines work. That doesn't make it impossible to get the disease. But what they showed in the study, if you got the fake vaccine, what they call the placebo, 95% of all the infections in the study occurred in that group of people. We get excited when a drug or a treatment comes out and it shows 10% effectiveness or 15% effectiveness. To have a 90 to 95% effectiveness is truly an amazing treatment. And so, yeah, this is an extremely effective intervention, and it's why we're so excited about it.
What are the side effects to the vaccine?
The side effects in the study were extremely minimal, and I'm not going to downplay them. There were people who had headaches and body aches and symptoms basically similar to kind of flu-like symptoms for several days, and not everybody had those symptoms. More importantly, no one had any serious side effects. No one required any medical treatment for a side effect. No one required any hospitalization for a side effect. And this is out of, I think, 21,000 people, at least in the Pfizer study, that received the actual vaccine. And and if you look at that and you compare it, let's just compare it to our community's experience. We've had a little over 300 patients have coronavirus in our community, and we've had patients who have symptoms still 6 months after the coronavirus. We've had 3 people die, and that's out of 300 some patients who got coronavirus. And I compare that to 21,000 who received a vaccine and had no major side effects, and 300 patients who've had coronavirus and had these very serious side effects or death. That's an easy comparison for me.
I know some people are concerned that the vaccine was developed relatively quickly. Does that concern you in any way?
Yeah, Aaron, that's a really common concern. And I'll be honest with you, it's a concern that I shared back in the beginning when we were talking about developing a vaccine within a year and doing something that was unprecedented in humankind. I don't share that concern anymore, and I don't share that concern because they did what they needed to do to prove that the vaccine was effective. They took all the same steps that we've taken to prove safety with other vaccines. We were able to do it really quick because coronavirus is really common, and they got lots of sick patients, unfortunately I guess, but fortunately for the development of the vaccine, they got lots of really sick patients very quickly to be able to gather the data to then prove effectiveness of the vaccine. So of course it's going to happen quickly because that's all they're working on. All their best minds and all of their resources are going into this development. So it happens more quickly. That's not and should not be a surprise.
I hear a lot of people are hesitant to get the vaccine. Does that concern you in any way?
I think you have to consider the risks and you have to assess that. That's just like with anything in life. The studies, have shown that out of the 21,000 people in just one of the studies, no one had any serious side effects. And someone may say, well, we don't know the long-term effects, and I'll grant that. We honestly don't. We do know, based on the science, that there shouldn't be any long-term side effects, but I don't even know that matters, because we don't know the long-term side effects of getting coronavirus either. We know some of the semi-long-term side effects are very serious. There's these long hauler people, there's people who get cardiomyopathies and things that are very serious that last. And we know the short-term side effects for a significant portion of the population are very, very serious, including death, which is not the case with receiving the vaccine. So I'm much more afraid of not getting the vaccine than I am of getting the vaccine when you do that risk assessment. And that's what I think every person needs to do for themselves. We can't keep going on like this. And the vaccine is one of the major, if not, it is the major way that we get out of this mess. And any risk to the vaccine at this point that I can conjure up in my mind, based on the science and based on the data, pales in comparison to the risks of not taking the vaccine.
From what you're telling me, it sounds like you're in favor of this for yourself.
Yeah, I will definitely be getting the vaccine. And I don't know that I would have answered that question very confidently 6 months ago. But we're not 6 months ago anymore. And I've been watching the studies extremely closely. I've probably argued and debated the merits of just about every coronavirus study that's come out with my colleagues twice. And, I've been a doctor, obviously, for over 20 years. I've been doing this for long enough to feel very comfortable in assessing when we develop good treatments and when we develop bad treatments. And so for me, it's basically a no-brainer at this point. The vaccine is how we move forward. I haven't seen my mom since this whole mess started. That's been really sad, right? And it is the first step towards ending this. And I feel like the light is finally at the end of the tunnel. So yeah, no question I'm getting that vaccine when it comes out.